So today is the Lunch and Learn presentation. We have guest speakers from the San Diego Alzheimer's Disease Resource Center for Minority Aging, the AD-RCMAR, which is a partnership between UC San Diego and San Diego State. And we are lucky enough to have two presenters today. So Dr. Alison Moore is the lead PI for the San Diego AD-RCMAR. She's a professor of medicine and psychiatry and the chief of the Division of Geriatrics, Gerontology, and Palliative Care at UC San Diego. She also serves as the vice chair for equity, diversity, and inclusion for the UC San Diego Department of Medicine. She is a geriatrician researcher with expertise in diverse populations of older adults, including the design and testing of age and population-appropriate assessment tools, as well as behavioral interventions. She's the recipient of UC San Diego Health Sciences Faculty Excellence in Mentoring Award and has a long-standing interest in mentoring others. She holds leadership positions in pertinent training programs, including the ADRC REC, the UC San Diego's NIA-funded T32, focused on aging, and UCSD's longstanding NIA-funded T35. So a very established career, lots of excellent work, especially in this area. And then Jennifer Reichstadt will be co-presenting, and she's the program administrator for the San Diego Alzheimer's Resource Center for Minority Aging Research. And she's a gerontologist who serves as the Director of Education and Development for the UC San Diego Division of Geriatrics, Gerontology, and Palliative Care. In addition to the AD-RCMAR work, she's the administrator for the local HRSA-funded geriatric workforce education program. So we're one of the sites for that program as well, and enjoy getting to be part of having those social work interns here from San Diego State. And she's also a member of the San Diego County Alzheimer's Project Initiative and develop partnerships with many local organizations. So we really appreciate these ladies joining us today and sharing their expertise with us, and have been very grateful for the partnership and being able to collaborate on a number of initiatives as our work really closely aligns and overlaps. So thank you for being here today, and I'll let you get started.
Thank you, Christina, for that wonderful introduction. And I want to start off by thanking you all for attending today, and also thanking Jennifer most of all, because she is really the infrastructure upon which this program is built. She's the backbone, the brains, the whole thing. And I'm grateful to be affiliated with her. She definitely made this presentation happen too. So thank you, Jennifer.
Thank you.
Next. Yeah, it's true. Our Alzheimer's Disease Resource Center for Minority Aging Research is one of a series of RCMARs, as they're called. So to just give you a little bit of the history of these programs, it's funded by the National Institute on Aging, and the RCMARs were first established in 1997 with the overall mission of improving the health and well-being of older minority populations by identifying mechanisms for reducing health disparities. I'm going to say that's evolved over time, and we can talk about that a bit more as we talk about our center, but the centers were also designed to enhance diversity of the aging research workforce. So currently there are 18 centers across the US, and in 2018 they added 8 that were focused on Alzheimer's disease specifically. So before the RCMARs, none of them were focused specifically on Alzheimer's and related dementias. They were more, I'm going to say, generic. But in 2018, they added 8 specifically to focus on Alzheimer's and related dementias, and to address social and behavioral related issues, or issues related to Alzheimer's disease and related dementias, and with the intent that they be ideally pretty close partners with the ADRCs, which have a different mission. The coordinating center since the inception of the RCMAR programs has been at UCLA, and so they sort of are the steward for the collection of the RCMAR programs. Next slide, please, and they have that nice little logo. So these are the sites where the AD-RCMARs are. Some sites have both an AD and a non-AD focused RCMAR, but these are all the AD-RCMAR sites. So you can see they're mostly around the edges of the country, and some have specific areas of focus. So starting in the top left, we have the Native Alzheimer's Disease Resource Center for Minority Aging Research, which is in the eastern part of the state of Washington. I'm going to say is partnered with another RCMAR that's also Native American focused, that is an Alzheimer's disease centric, I'm going to say. And then we have one, USC has one that's focused on economics research in Los Angeles. We have ours in San Diego that's focused, we'll talk more about that later. There's one in Texas, Rio Grande Valley, that is focused on Latino ADRD. There's one in South Carolina and there's one in Hopkins that's focused on Black Americans. I'm not sure what Carolina's focus is, sadly, but Jennifer, if you remember, tell me.
I don't remember.
Yeah, and then Columbia has one that is, I think, fairly broadly focused. Jennifer Manley's there. She's a giant in Alzheimer's disparity research. She also trained at San Diego originally. And then in Michigan, in Ann Arbor, they have a regular RCMAR that's been there forever. And then they have the Michigan Center for Contextual Factors in Alzheimer's Disease. And they focus on a variety of population, including Arab Americans there. So those are the 8 new sites just funded in 2018. And they were funded because of the NIA's, major focus on AD, RD, as you guys are certainly well aware, and rising cases of AD worldwide, disproportionate in communities of color, and then need for a strong, diverse workforce to address this challenge. Next slide, please. The RCMARs utilize this NIA Health Disparities Research Framework that I think was issued initially in 2015. And so it's the National Institute of NIMHD, National Institute of, I should know what that stands for. It's the Health Disparities Institute, I'm going to say, have another framework that's similar. But this one is the original. And so it looks at sort of big issues related to health disparities. So they use the priority. I forget the priority part. This is embarrassing, but anyway, they have the main components are environmental, sociocultural, behavioral, and biological, and examples of factors that go in each one of these. Main domains are listed on the slide. And then they use the life course perspective, which means, they don't want to look just at people in the, end of their life. They want to look from, kids onward in this way. And then the priority populations, I think, are racial, ethnic minorities, sexual gender minorities, rural populations. They have a listing of priority populations. I saw this not that long ago, frankly. And so they encourage investigators to utilize this framework when, thinking about research they're planning to conduct. So, next slide. So the AD-RCMARs are all located in the NI Division of Behavioral and Social Research, and so they're again part of Disparities Research, and so it's different again than some of the other NIA funded centers in that it really is behavioral and social research. It can cross other types of research, and we certainly do in our center as well. But in some of the areas that you can see also that we do address our, caregiver research, prevention of dementia, behavioral social pathways, epidemiology, brain changes that occur at various times of one's life that could be risk factors and or consequences, caregiving or care for dementia care, people with dementia, a lot of different types of research. Next, please. And still me going? Yes, I think so. Okay.
Yeah.
or is this you, Jennifer? It's still me?
Nope, this is you. Go for it.
Okay, all right.
I'll jump
And
in
then,
whenever.
and then, we're going to have time for questions, by the way, at the end, unless you want to. And it's hard for me to know if there's questions in the interim, but certainly at the end, or during, you're welcome to ask questions. So we're in the fourth of our 5-year grant. The good news is, and we hope we're in this crowd, most RCMARs are refunded. I was at UCLA before coming here for a very long time, and that RCMAR has been funded continuously. So you have to work, but these centers usually are refunded. So the purpose of our center is to enhance the diversity of researchers studying ADRD. And we do this through recruitment and career development of scientists from underrepresented backgrounds. And we also wish to fill critical gaps in ADRD research. And our center has particular strength as being focused on Latinos. So many reasons for that. So that's what we do. And then our partnership is with both, us at UC San Diego, Super Strength in Neurosciences, you guys, and then as well as geriatrics, gerontology, psychiatry, and then at SDSU, which has been a Hispanic serving institution, has strong programs in community and public health, as well as psychology, and has, certainly had much stronger history of work in health disparities when we were submitting this proposal. And next. Still me, I think. Okay, and then this is center leadership, so you'll recognize some of the people on here. So the PIs, we have a 4 PI structure, which is a lot of PIs. So Hector, you'll recognize. So he was part of this proposal when he was just transitioning from coming here from Michigan State to UCSD. And as you guys, most of you will probably know, he's the PI of the SOL Inc., our study of Latinos, investigation of neurocognitive aging. So many of our scientists have used that study for their work. He's an outspoken advocate for Latino ADRD work. We also have 2 PIs from SDSU, John Elder and Paul Gilbert. John is a giant in the field of public health with a very strong focus on Latino scientists and Latino work. Been in this field for a very long time. And then Paul Gilbert is chair of psychology, and he's had a long history of conducting work in Alzheimer's disease, Parkinson's disease, other types of neurocognitive disorders. That's really his wheelhouse. So we had a nice partnership with our 2 institutions, and a strong history of mentorship. I'm not while I care for many people with Alzheimer's, I'm not an Alzheimer's researcher, but I have a long history of mentorship of diverse scientists, and have a research portfolio that includes disparities research, so we kind of as a group make a nice team for this work. Thanks.
Let's see.
Slide.
So yeah.
Still me, Jennifer?
Do you want me to jump in? I give you a break.
You got, yeah. Please.
So of course, to make our center possible, along with the wonderful multiple PIs that we have several other faculty that are intricately involved. Some of these you will notice actually are also individuals affiliated with the ADRC here. Of course, Dr. Brewer, who's the director, is actually part of our team, which has been great for collaborations. Steve Edlund as well is also part of our team and our analysis core. Linda McAvoy as well, actually a wonderful team. As you can see, a nice blend between UCSD and SDSU, with each individual really bringing their own unique strengths to the program, whether that be analysis, mentorship, career development, and so forth. So, and then the program is supported by 2 of us as the administrative group. And so I get to work a lot with the administrative team at the ADRC, which is always a pleasure. Our center theme, as Dr. Moore had mentioned, we really focus on Alzheimer's disease, but pertaining to social and behavioral science. Again, whether that be looking at the epidemiology of ADRD, preventive interventions, care challenges, That's really our focus more than the kind of basic science side. Transdisciplinary research is certainly encouraged. And we also, as a center, have a strength, as we mentioned, specifically focusing on ADRD and older Latinos. Some of as a snapshot of the activities that we provide as a center. So we do recruit 3 to 5 we call them AD-RCMAR scientists on an annual basis. We provide them not only with pilot project funding to complete a project related to ADRD, but we also really provide them with a lot of guidance and a lot of mentorship to help further their careers. Educational activities we have include a monthly seminar series, which I'll talk a little bit more later on. Workshops, we have done some in collaboration with the ADRC that I'll mention later, but also get that coordinating center that's through UCLA as well. We try to bring a lot of the activities available across the RCMARs to our scientists. Career development support, as we mentioned, is a big part of our center, whether that be assistance with writing, making sure ability to write papers and grants, having the assistance they need. But also we spend a lot of time on career development topics, whether that might be, benefits of finding a hard versus soft money job, lots of different areas that are of interest to our participants. And networking is also a piece. A lot of, our scientists are traditionally postdoc fellows or junior faculty. So the ability is they're starting their career in this field to be able to network with others doing similar research, whether that be here locally or across other RCMARs. AD-RCMARs is an important component. Analysis support is also important too. We're finding that definitely not only the methods and the analysis, but really at the start, trying to provide that support even as people are beginning to develop a project, really having a look at the design that they've created and see where they might make improvements. Data resources is also a big piece of our center, and wanting to really be a resource for a lot of the large data sets that exist, being able to have those available to our scientists who are interested in developing a project, making sure they know how to gain access to those data sets and how to utilize those large data sets. So we have a great strength here in San Diego with a lot of key people, Dr. Gonzalez, Dr. McAvoy, who also as well, that have the ability to kind of help scientists along the way. Our overall program structure, we're really similar to the ADRC that has different cores. We have 3 cores: the administrative core, a research education core, which I would say really is the heart of the center, and then an analysis core. And that certainly evolves based on the needs of the individual scientists. We've certainly recognized that not each scientist comes into the program with the exact same set of skills or knowledge base. And so kind of really coming and helping scientists where they are at the introduction of the program. We do have an executive committee that meets regularly to discuss the operations and future of the program. We also have an external advisory group that is comprised of really 4 experts in the field with diverse expertise across the US that gives us guidance on our center and how we can make improvements. When we do solicit proposals for pilot projects, we do have a review panel that will take a look at those and make recommendations. And we also work with several community partners, and that's where I think there's a lot of wonderful overlap along with the ADRC, whether it be Southern Caregiver Resource Center, Alzheimer's San Diego, several of the partner sites here in San Diego. We try to engage them where we can. As I mentioned, we have a seminar series. It's currently held the first Wednesday of the month. If anybody would like to be on that mailing list, they can certainly reach out to me. I'm happy to add you. It's really been something that's evolved over time, trying to figure out what is most meaningful to the scientists that we're supporting. A lot of our seminars are topic focused, and we're have quite a range. This is just a sampling of the topics that we've covered. Certainly always evolving and changing what those topic lectures might be. And it might be someone here locally, or sometimes the advantage of Zoom, of course, right now too, is we can bring experts from across the US to present to our group. As I mentioned, we focus a lot on career development. This is just some of the areas that we've covered with our group, and that also continues to evolve based on the needs and interests of our scientists. We do focus some of our lectures specifically on methods and analysis. That is something that if there are individuals with a topic, one of our goals is to invite individuals from other training programs here, whether it be the Rec Scholars through the ADRC or a T32 grant. We've started to invite as well Madura students and ADAR students from SDSU. Certainly some of these topics might be of relevance to individuals beyond our AD-RCMAR scientists. Alison, do you want to chat about our scientists so far?
Yes, thank you. So we've been in business for 4 years now. And as Jennifer earlier stated, we recruit 3 to 5 scientists for funding each year. And we've funded to date 12 scientists. Scientists have the ability to be funded for more than one year, and they have to have different projects for each of the years. But so we've done that for 2 of our scientists so far. And these are some of their accomplishments. And you can see in the bottom that scientists we have funded to date. So it's Maria Marking, who you all may know. She's now in our division happily. Associate Professor Melody Shafino, who's at SDSU. Oh God, I'm losing people's names. This is horrible, Jennifer.
I'm impressed that you're trying to give a snapshot of
Priscilla. Yeah, Priscilla Vasquez, who worked with Hector here, and she's now at Drew. Monica Diaz, who's now at Duke.
North Carolina.
UNC. Okay, she's a neurologist. Ale, who you guys know, she works with Hector now. Or led Umberto Parada, who's at SDSU. He's now head of epidemiology there. Tala Alrosan, who's in the School of Public Health here. And Graves. Lisa Graves, who's at Cal State San Marcos. She's a postdoc here, neuropsychology postdoc here. Ariana Stickle, you all know, she's with you all. It works with Hector. And then Zvinka Zlatar, who works in the memory disorders with you guys. She's in psychiatry. Did it. All right, okay. So the overall, some of the accomplishments they engaged in is that, 3 have gone from, postdoc to faculty. Some have been promoted. Maria's director of Disparities research in our division. She's this year getting the health. She's getting the Health Sciences Mentorship Award next week. Is the ceremony, so that's wonderful. We have one of the scientists. We've had some ins and outs of this, but now Umberto is one of our AD-RCMAR faculty. There's a thing called the RCMAR Scientific Advisory Board, and that is is a collection of the current and alumni scientists who do what it says. They advise the overall RCMAR program. So 3 of our scientists are on that board. We've had, multiple grants they've been successful in obtaining, as well as a lot of papers. So more than 85 publications. So one of them, Maria had like 30 papers in this one issue of Clinical Neuropsychologist on norms for Spanish speakers. And some of the scientists here were involved in those publications as well. So we've had, great success, which we've been very pleased by. Really, scientists are outstanding. And next slide, thank you. So these are our current scientists. So 2 we didn't have on the prior slide. Melody was there. So one of them is Casey Dieter. She's also involved with with Sarah Banks. So she works with Sarah Banks. She's, I think, her postdoc. So Casey is working on a project called Race and Sex-Based Disparities in Cognitive and Genetic Alzheimer's Disease Risk Factors, and she's on the job market. She's a hot candidate. We've been hearing about that. Angela Gutierrez was a postdoc at USC, and she's an assistant professor in the Department of Social Medicine at Ohio University, Heritage College of Osteopathic Medicine, and her project is on stress exposure and cognition among older Latino adults. And then finally we have Melody, who's an assistant professor in health services and epidemiology at SDSU, and her project this time around is on improving identification of dementia and cancer research using claims data in diverse older adults. That's our current group. And then the scientists here that have been active in neurosciences, which I really just went over in that other slide, are, Casey Alejandra, who's applying for a KO2 now, and she was also selected by the ADRC as a Rex Scholar for this year. Ariana, who I think they're about to get a K, and then Zvinka, who's going up for promotion soon, I think. She already has an R01, so she works in this memory disorder clinic. So thank you, neurosciences.
So some of the benefits of science for scientists, as we already kind of mentioned, of course, strong mentorship is a big piece of what we do as a center. Some of these I already covered, but in terms of, helping individuals with their research design methods and analysis support, writing assistance. One of the things, though, that we like to point out is becoming a member. You really become a member of both a local and a national RCMAR family. And it goes way beyond the 1 year that they might be funded for a pilot project. We're continuously looking at ways to keep engaging and being there to support them in their careers moving forward. Definitely a lot of interdisciplinary collaboration, which is always fun. Learn from each other across the board. Opportunities when we can to certainly support them for travel, whether it's to present, whether to network. We definitely want to be supportive in having those opportunities. And ultimately, our goal is, of course, to assist them in increasing, in the career development, both increasing publications, being able to obtain grant funding, and hopefully advance as well in their academic positions. But other benefits of the AD-RCMAR program that go beyond just the benefits for scientists themselves is, of course, it's a small cohort, but really looking at what are the benefits our AD-RCMAR program brings to others. So basically, along with conducting important research and supporting researchers, we are trying to make our seminar series available to others who might benefit from some of the topics. We are also beginning to record those. And so just developed a YouTube channel that has some valuable information and content that people might benefit from. We, of course, love the fact that having the AD-RCMAR has really enhanced our partnership with the ADRC. We have certainly, of course, have a lot of mutual goals. Really also working to collaborate across the pipeline of training programs. We do have overlap in faculty regarding, the NIA-funded T32, the ADRC Rex Scholars, but as I mentioned, really also reaching with the Madura program, the ADAR program, MSTAR as well. One thing to also note is our center can be a parent grant for applicable diversity support. We do have an individual, Micaiah Funk White, who is at SDSU, part of the SDSU UCSD JDP. We were able to help her and support her for a diversity supplement through our AD-RCMAR. And again, also another opportunity to engage with community partners. I think there's a lot of room to grow with that and figuring out the best to, support each other in terms of their goals and interests and where we can help them maybe address the research question and so forth. And making sure that our scientists and our team also knows the available resources to them. We've done also, as evolving as a center, we've actually been able to, I think, play an important role in advocacy and leadership. Really advocates for increasing diversity in research. Nationally, members of our center have participated in several efforts. Some of them include participating in a review of NIA and NIMHD frameworks of diversity and disparities, contributed to the written response on the NIH Unite initiative to end structural racism, We've developed an Alzheimer's Association International Conference featured research session. And of course, I'll give a shout out to Dr. Gonzalez for the work there. So it's been a wonderful pleasure, not only as our own center, to be able to think of ways we can be an advocate and lead, but being part of a broader community within all of the RCMARs has been, there's power in numbers. We also have had several of our faculty who have taken on new positions that I think are fantastic. Dr. Moore, as mentioned, is the vice chair for JEDI in the Department of Medicine. She's also on a National Alzheimer's Project Act risk reduction work group. Dr. Halamadinat is actually SDSU interim VP of research. Dr. Markeen, as we've talked about, again, is director of disparities research in our division. Dr. Gonzalez has been invited in multiple positions across the country, but is a panelist for the National Academy of Sciences workshop addressing health equity. And of course, since we are talking with the ADRC, I wanted to point out some of the ways that we have been able to collaborate together, and of course, welcome additional ideas for how we can collaborate further. Hopefully many of you know some of the workshops that we've put on jointly. The last one we had was held in June 2021. And our goal is to ideally host annual joint workshops together. We, of course, have joint faculty that are working between both centers. We are really trying to engage the Rec scholars in our trainings. We invite them to seminar series, and also really kind of that communication between our two programs to really make sure we're maximizing the support we can for good researchers that we want to provide support to. The Madura program, of course, is tied with the ADRC as well, and trying to find those that have an interest in what we're doing and invite them to our activities. And I know some of our scientists have had the opportunity to present as part of the ADRC and their multiple lecture series too. So it's been fun to figure out ways that we can continue to engage and collaborate. Dr. Moore, do you want to take this one on?
Thank you. So future plans and considerations are always evolving. So we, want to continue to strengthen our collaborations across the programs, the other RCMAR and AD-RCMAR programs. We are interested in exposing our scientists and doing work with other studies. So the one of the AD-RCMARs is in the Rio Grande, that's the UTRGV. So we would like to develop more strong ties with them. There's also the ABLE study. One of our advisory members is Sid, his last name is going to escape me. I'm not going to get that one. Sid O'Brien. Anyway, so he's the PI of the ABLE study, which is a diverse cohort, and looking at a lot of different measures of cognition there. It just, it's a pretty new study. And then along with the Michigan AD-RCMAR as well as their ADRC, we've explored it, worked with them as well, and are doing some work with them. The one that focuses on Arab Americans, Tala, one of our alumnus scientists, has done some work with them on Middle Eastern populations. We always are looking to improve our networking opportunities. In person has pretty much not been happening too much, except for an annual event at John Elder's home. That picture you saw of us together is at his house. He lives in what part of town, Jennifer? It's near you. It's in
Mount Helix area.
He lives like on top of a mountain. That's clear. He lives like on the top of a mountain, and it's amazing views. We want to engage pipeline. That's some of the work we've been doing with the T35, so medical students, postdocs, graduate students, the Madura programs for undergraduates, and the ADAR programs for undergraduates. So really trying to work with a pipeline and enhance the focus on research ethics for ADRD populations. That's where Camille Nebeker has been a newer member of our group. That's her wheelhouse. And then increasing our sharing of outputs and center accomplishments. As saw earlier, Sasha Weiss, there's Sasha, is a new member of our group as of last week. So she's, and Leslie also has been working in this area to try to get us out more in the media and social media. And then developing community collaborations, we have them. We still are working to strengthen them, do some additional, think about doing research actually with community more and more would be something we'd like to do. And then increase our focus on public health. Again, the centers are social behavioral research. We have a new school of public health. SDSU has a well-established school of public health. Thinking about sort of expanding our reach into that realm and looking, engaging investigators to do more work in that space is something we'd like to do. And how to contact us. We have a website. That was a big lift. Thanks to Jennifer, we have a website. Very thrilled about that. We have a Twitter account, and we have good old-fashioned email as well. Happy to take questions. Thank you so much for inviting us. We're thrilled to be here and to collaborate and get new ideas.